My name is Kelly DeLeon. I am the Manager of Community Health Education and Social Impact and Community Investment at Monmouth Medical Center Southern Campus. So a community health educator literally works with the community to educate them on health and wellness. So I spend most of my time educating people on issues that are important to them and their health. So, for example, I work with older adults and I oversee a wellness program specifically for people who are 65 and over. And the program involves everything from socialization to physical activity, education on nutrition, and just good health information to keep them well and healthy and staying out of the hospital so that they are living independently for as long as possible. So for older adults, there are topics that are really important specifically for that age group. And it would be definitely things like nutrition, staying active, how they can stay healthy and live independently. So things that go along with that are eating well, taking care of your body, exercising. Older adults are also really interested in keeping their brain healthy. They want to stay sharp and remember things. So falling is one of the biggest concerns that older people have. It's also one of the things that they're least likely to talk about because it's a sensitive subject. They're embarrassed. They're afraid if that they're having falls, that they're going to lose their independence somehow. So teaching people that falls are not a normal part of the aging process, that falls are usually the cause or something else is causing the fall is the messaging that we share with older adults, and that most falls can be prevented by exercising, staying active, treating medical issues that you might have. I think kids know so much about health and wellness. I know that in the schools, they're learning about healthy eating, avoiding things like diabetes, staying active to have a healthy lifestyle. And so those are all things that kids can model for their grandparents and show them that you can do this and you can take control of your health and be well. First of all, of course, working with people. So being out in the community, meeting people where they are, and just interacting with the public is what I like best about my job. But it's also really fulfilling to provide a program for somebody that you know is making a difference in their life. For example, if we're doing an exercise program for older adults who might not otherwise go to an exercise program or have the ability to socialize with other people, it's really rewarding to know that we connected them with those things. So one of the biggest challenges in the work that we do is definitely the fact that there's so much work to be done, and it doesn't always feel like we have the time or the resources always to meet all the needs that are out there. So that was probably the greatest challenge we've had in this role, this change in the way we delivered health education, right? So we were all away from each other. We had to do everything virtually, and to find a way to offer community health education virtually was really a challenge, especially for older adults. So helping connect older adults on online platforms where some of them had never even gone on the web for something like that. They might have had email addresses, but never really went to things online like that. So connecting people with these resources during COVID was really challenging. Understanding data, right? So looking at what the health needs are of a specific population and interpreting that in a way that helps you develop your programming is how we would use all of that: math, reading, writing, technology, again with presenting programs virtually, using the internet to inform people, to provide health education, to send messages to people about their health through email or through a web page. So my background, my education, I actually was an elementary school teacher to start. So I already had an interest in teaching and educating people. And then I went back to school when I became an employee of the hospital. The hospital system actually assists with paying for your education. So I went back to school. I actually was a new mom. I had twins, and I decided it was time to go back to school. So I went and got my master's degree online in health education. So that is the background that I have to serve in this role. So for anyone thinking about a career in healthcare, I would definitely recommend looking for volunteer opportunities in hospitals or in other healthcare settings. So you really get a good picture of what that setting looks like, right? And then I would recommend talking to professionals that you meet along the way, asking them what they like about their job, what are the challenges that they face. So looking for an area that interests you and kind of researching it a bit more with people that you meet.